Okay, we're rolling. Happy Friday. It's the end of our second month. It's 8 weeks. I don't know about you, but I'm kind of sick of this. I think we all are. Let me just give you some data for some good news for Houston. Once again, we've been following new diagnosed cases and then hospital admissions. And the new cases have gone up a little bit between 200 and 300, but we expected that because our testing is getting more thorough. We're doing much more testing, and the percentage of tests that are actually positive is dropping, something we all anticipated would happen if we tested more. The real leading indicator for me and for most of the Texas Medical Center leadership is how many people are coming into the hospital, because that gives us a better idea of how many people are really getting the disease, getting sick enough to be admitted. And that number continues to drop. So I'm very, very pleased that it looks like we're sort of at this steady state right now where there are new infections in the community, but it's something well within our capacity to handle as a healthcare delivery system. But I do want to talk a little bit about how we're now going to start opening up. So on our clinical mission, we've been running about 25% capacity, and we're beginning now to increase the number of patients coming in to see us through the clinic. I anticipate that we will be pretty close to 50% volume within probably a week or two. Next week, we plan to begin to open up the research mission a bit. It's a little bit more difficult. We've spent the last 9 years since I've been here, creating increased density of people doing research for the obvious reasons. It's better for us. But now in the world of COVID-19, that's not good for us. And so we've got to figure out how to put the same amount of research into space without compressing people into being next to each other all the time. So social distancing is going to make things different. It's not going to be easy for people who run labs. You're going to have to do shifts. You're going to have to change spatial arrangements at the benches. And Mary Dickinson is working very, very hard to do that. So we are opening up gradually and thoughtfully. We're not going to be stupid about it. We're going to try and be intelligent in what we're doing. I think everybody has got to begin to understand that it's not testing as much as practicing social distancing. That has been the one thing that's worked. We will do more testing for sure, and we will develop testing for our workforce. We will make sure that if people are positive, we will do contact isolation, we will do contact testing. All of that will happen for our own internal workforce. But the best thing is to keep people from getting it to start with, and that really means embedding social distancing into the workflow. And I said this last week, if it looks like business as usual or pre-COVID, then it's not right. And that's on campus, and that's particularly in your community. I'm very, very worried as restaurants and bars begin to open up, as people begin to socialize again, that they will not pay attention to social distancing, and that would be a real disaster because the virus is not gone. It's there, and it's just waiting to get people together so it can just jump from one person to a person. Now, one thing I would like to really stress this week, I am completely burned out. I am so sick of 24/7 managing every issue that comes up. And I know every one of you feels exactly the same. We've changed our lives to accommodate the crisis at hand. The problem is that this is not going to go away. We are probably living with this for 12, maybe 18 months. And so we all have to figure out how to rebuild our daily schedule to be normal. Or not normal, but how about this? To be one you can live with. My current daily habits are not ones I can live with. So we're going to have to figure out ways to begin to socialize again. So people can get back together, but they just have to be apart. You can go to a friend's house for dinner, but you just can't all sit next to each other. So there are ways to begin to do this, and I want each and every one of you to think as we approach the Memorial Day holiday, what you can do to take some time off. For those of us who've been at it 24/7, take some time off. Take a few days. Take the Memorial Day holiday. decompress. Start thinking about how can you return to an existence that you can live with over the next year, and do it responsibly and reasonably within the concept of social distancing. We're going to close today. I think I'm really excited about the fact that our a cappella group, known as the Docapellas, have figured out how to keep going, they can keep their a cappella group going in spite of the fact that they're distant, and they created a fantastic program that I'm going to share with you. It's a combination of our med students and graduate students, and they really did a fantastic job trying to be normal in clearly an abnormal world. And then I also wanted to finish with the fact that my stress animal has been Lily. I introduced you to Lily before. And I had some key questions to ask Lily about how she felt about being locked down and what she saw of the future. So we're going to end with that. And once again, I want to thank the Baylor community, but this one I want you to take a giant chill pill. I need everyone to start thinking about how can I live the next year or 18 months in the new world. And so try hard, Baylor. I know you'll all step up. I'm really proud of everything our institution is doing, and every one of you who are here are contributing to this mission and to our institution and the city of Houston. And I want to congratulate you for the fantastic work you've done, and I want to thank you again for being part of our fantastic institution. Thank you, and have a great weekend. Thank you.